graduated from several schools here, the NIH Cardiovascular Fellowship, and earned his master's degree in biochemistry. And then he later graduated from the College of Osteopathic Medicine in Des Moines, Iowa. His postdoctoral training, a clinical rotating internship at Providence Hospital in Seattle, Washington, 3 years at Case Western Reserve, and 1 year at Oregon Health Sciences University. For the past 14 years, he's been a pioneer in creating and implementing a comprehensive rehabilitation program for stroke and brain-injured patients using hyperbaric oxygen, pulsed electromagnetic therapy, neurobiofeedback, acupuncture, electrical stimulation, physical therapy, and external counterpulsation, an FDA-approved non-invasive device for angina and congestive heart failure. He's also been successful with other tough cases, including autism, cerebral palsy, MS, ALS, Parkinson's disease, macular degeneration. I give you David Steenlein.
Thank you. Thank you, Michael. Can everybody hear me? We're okay? We're all set to go? No? I need to be louder. I can speak louder. Is it okay? We're fine. All right. Anyway, I got to readjust my microphone.
It's just wanting to be difficult. That'll do right now.
Okay. All right. Well, just a quick summary of my career. I used to practice here in 1977, the fall of 77. I was here for like 4 or 5 months with Carl Ebnuther, and he was a cardiologist over by Stanford, and we had a parting of the ways, and I moved on to Southern California, mostly because it was so cold up here. And I said, I'm going to go where the sun is. And so I headed south. And I've been down, it's where I live and practice is about an hour south of LA and about an hour north of San Diego, close to Laguna Beach. And it's a very beautiful area. And I have a multifactorial type of clinic where I treat a lot of kinds of cases with a lot of new technology. And so I'm really a highly technical kind of doctor with real high-tech stuff. And I'm trained as a biochemist and as a pathologist. I've dealt with the toughest cases for a long time. And one of the things I did was, back in 1991 or so, I had a patient with an acute stroke. She was my patient, had severe atherosclerosis, hardening of the arteries, and I told her, Dorothy, you're going to have a stroke or heart attack unless you change your ways. And she didn't want to change her ways, as some people do, and she did. She had a stroke. Her daughter called me up and said, Dr. Seemluck, what do I do? We're at the hospital. They want to put my mom into intensive care, and I don't know what to do. I said, well, I'll tell you what, why don't you call an ambulance and put your mother into an ambulance and bring her over to me from the hospital. Instead of putting her in intensive care, bring her to me. I'm supposedly a general practitioner. And so the doctors at, it was Hoag Hospital, the doctors at Hoag Hospital went ballistic, said, are you nuts? How dare you take your mother? She's had a stroke. My God, you're going to kill her. You can't take her out of here. And the doctor said, watch me. And she drugged her mother. They wheeled her out and put her in the ambulance. And here comes the ambulance to my office. This was at 9 o'clock in the morning. She called me. By 3 o'clock, she was in my office. I look at her, and she is gone. You know, she is comatose, basically, and really, really bad case. And I'm going, oh, what did I get myself into? This is going to be fun. And but hyperbaric oxygen. Yes, I know about hyperbaric oxygen. Dr. Neubauer taught me that you can really do great work with hyperbaric oxygen, putting a person under oxygen pressure, pressurizing that damaged brain, and that'll get in there and fix that brain like that. I put that lady in there and pressurized her right up to 2 atmospheres and sat there and waited for her to jump up and say, eureka, I'm cured. She just lay there like a lump of coal. Didn't do a thing. I said, you didn't do what you're supposed to do, lady. You're still in a coma. I said, oh, God, I'm now got to actually practice medicine. And so I went to my kitchen cupboard, and I had a nice kitchen cupboard with a lot of little tricks. And I pulled out this and I pulled out that, and I put together kind of a conglomeration of antioxidants and free radical quenchers and blood thinners and whatever I could think of, threw it at her for about 3 hours, and I used a pulse magnetic field therapy on her back of her head, which increases blood flow as well. And I put her back in the chamber after that 3-hour IV, and after 1 hour of that, she got better. She actually got better. And I did another IV, and then another hyperbaric after another 4 hours, and I went like that, IV, hyperbaric for 24 hours, and in 24 hours, she walked out of my clinic, back together. Back together. Never had to have rehab, nothing. And I got a CAT scan on her 3 or 4 weeks later, and she had a massive stroke. And what that taught me was that a stroke is caused by, yes, a blockage of an artery, but the blockage causes a central core of dead tissue that then swells and causes a great amount more damage, which if you can stop in the first 24 hours, you can stop like 80% of all the damage from all the strokes. And that's unfortunately not occurring today in our stroke rehabilitation. So anyway, I decided at that moment that, gee, I should become a great stroke doctor because I can revive these people like that. And then I said, well, wait a second. If I have one patient that goes south on me and doesn't get well, I'm sure the medical establishment will come after me and take my license away and charge me for murder or something because I didn't do what they do. And so I said, well, I better not do that because that's kind of crazy. So I said, well, I'll just hold off and I'll just see what happens. And pretty soon I had a lady with a stroke 10 years out. She had a stroke 10 years before. She was in so much pain and was so miserable. She sat in my examination room in her chair and looked up at me and said, Dr. Steenblock, I am so sick of this. I've seen 22 other doctors. Not one of them has been able to help me. It's been 10 years. My husband has to feed me. He has to take my pants down to go to the bathroom. He has to pull them up. This is no way to live for anybody. And I want you to either help me recover from this process, or I want you to help me out of this world. And so I said, well, I do have a gas chamber. But instead of Xylon, I'm going to use oxygen. And she said, well, whatever. And so I put her in the oxygen chamber, and within just a few treatments, she was up and walking and screaming to everybody that would listen to her, Eureka, it's a miracle. I'm out of pain. I'm walking for the first time in 10 years. I can actually go to the bathroom by myself. And at that point, I decided that maybe I should stick with stroke and really start concentrating on stroke. Well, so then I started specializing in stroke, and we started adding all kinds of things. And we added physical therapy and occupational therapy and speech therapy and acupuncture and massage, everything you could think of, and I could pull together that would help people. And that's how our clinic evolved, and that's how I became the StrokeDoctor.com. If you look at my business card, which is down here, it's StrokeDoctor.com. You can go there, and there's just a ton of information about stroke and cardiovascular disease and all that kind of thing. I'd encourage you, if you're wanting to be educated more about all these kinds of things, I'd suggest that you go there. There's especially one that's called You're Only as Old as Your Arteries. And that article I would recommend for all of you if you're interested in smart life and staying alive and healthy, because I think that's what this crowd is all about. And that's because the artery, the rule of the artery is that the artery is supreme. If you don't have good blood flow and good oxygenation, you're going to deteriorate and you're going to die. And so you need to keep your oxygen up at good levels. And so anyway, after all these things and whatnot, I still found that some of my patients did not do as well as I wanted to, and so I started looking around, what else can we do? And so I started getting involved with xenotransplantation. I met Dr. Ramirez down in Tijuana, who's an orthopedic surgeon, and he's been doing spinal cord surgery. And he would operate on paralyzed patients and open up their spine and go in there with a team of neurosurgeons and dissect out the scar tissue of where the spine was injured. Dissect out the scar tissue and remove the calcium and open that all up and clean it up and dig through that. It would take 10 hours of operating to work on that little tiny piece of tissue. And then they would take the tissue from a shark embryo spine and brain, and take that tissue and then put that into that damaged tissue and then sew it back up. And lo and behold, he had 70 cases that had some degree of success. And I talked to some of those patients, and they actually did see some decent results. And they were able to go from being in a wheelchair and to be able to then walk with kidney sticks and that kind of thing. And they did have improvement in their overall condition. So this was not bogus. It was real because I myself interviewed these people and followed them. And so we started using that material on my stroke patients, and I frankly was not impressed. And so I started looking for what else can we do, and then of course stem cells started to appear, and so I started looking for stem cells, and I was able to help Dr. Ramirez get stem cells going, and he started using stem cells for patients. And this, what we're talking about today, is a collaboration between Dr. Ramirez and myself and my team. So I'm the technical consultant. Dr. Ramirez is the man that actually does the work, and I operate in California where I cannot do any of this, and until we change the laws. But in any case, I have a book out which is back at my hotel room. And so tonight we're just going to review some cases, so I'll give you a kind of an overview of stem cell therapy. Embryonic stem cells are very similar to umbilical cord stem cell, but umbilical cord stem cells, of course, are much more ethical, I think, to use. Just some of the successes. This is a patient, 56 years old, 10 years with progressive multiple sclerosis. He was able to walk, but he needed a cane. His speech was slurred, and he had difficulty swallowing. In July, 2003, he received stem cells, and within a month, his muscle strength, his speech, his swallowing dramatically improved. So, in other words, what we found with MS patients, multiple sclerosis patients, is that if a patient is stable and has not had any progressive deterioration, if you give them stem cells, there's really not much result. And that's like, some of you will say, well, what about just giving them to me? How about if I just take them? Well, if you're perfectly healthy, you have no aches and pains, and you're a perfectly healthy person, you're not going to notice anything, I think, in general. Now, if you have any kind of problems, you will see oftentimes some degree of help or resolution of those problems. This is a patient, Art Bulger. Art is a real interesting guy, and he's a businessman from New Jersey, and he's now about 79 years of age. He had a stroke, and he came to me for stroke rehabilitation, and we treated him for a couple months with hyperbaric oxygen and whatnot, and he improved quite considerably. But he also had macular degeneration. You all know about macular degeneration. It's that area where when you look at, like you're looking at me, that little part of the eye is the macula, and that when that degenerates, then you can't see me very well. You can see around here, but you can't see my face if you're looking at my face. So that's the fovea, the central part, and that's showed up there, some of the damage there. In any case, that condition is due to a lack of oxygen. And I don't have time tonight to get into why that's a lack of oxygen and all the treatments, because that's not the subject of this. But in any case, he had macular degeneration. He also had visual field defect from his stroke, and he also had glaucoma-induced optic atrophy. So he had like 4 different conditions that caused him problems. And in January of 2000, just a few months ago, he received 10 million cord stem cells, and he also had severe arthritis of his joints and his knees, and he had some injections there. He was in terrible shape. Within 3 weeks, he could see his food. Now, this guy was totally blind, couldn't see a thing. When I saw him in January, I took a bright light and put it up to his eyeball and said, "What do you see?" And he just, nothing, in both eyes, nothing. With a very, very bright light, intense light, not a thing. Could not discern any light whatsoever. In 3 weeks, he was able to see and see his food. It was a little bit fuzzy, but those symptoms continued to improve, and the pain of his arthritic knees disappeared, and he's up and moving around now, and his vision is not perfect, but he's able to get around. He can watch television. He's reading again, and he's a very happy camper because he's gone from blind to being able to see. We have the book that I wrote, the book on stem cells, umbilical cord stem cell therapy, has a lot of cases of cerebral palsy, And we chose, or I chose, to use cerebral palsy as a model because they're generally healthy children. They had a brain defect, brain damage at birth, a stroke, or some traumatic brain injury at birth, and so just part of the brain is damaged, and most of it's white matter. You know that you have white matter and gray matter. The gray matter is the outer part of the brain, which are like computer chips, since you're mostly engineers probably. And from the computer chips you have wires, and the wires are the white matter. And cerebral palsy, these children have white matter damage. The wiring is damaged, and that's why they can't use their muscles and whatnot, and they have such spasticity. So if you can fix the wiring, the white matter, they improve. And so I figured since they were young and healthy and had a lot of growth factors, and they had white matter damage, stem cells would be very effective, and that's what turned out to be. And these are just some cases here. You know, kinds of things, focus, concentration, being able to speak better. She was able to, you know, the ability to use their hands and whatnot have improved considerably. For example, one of the patients, 6 years old, totally spastic from birth, had spastic quadriparesis where her arms were like this, her legs were like that. This is how she went through the day. She could not, you could put her in a chair and she'd slide right out of the chair. She had to be fed constantly. She had to be taken care of. She was just totally incapacitated, and this is how she was growing up. 1 vial of stem cells, and within 1 month she was able to move her arms and legs. Not perfect, but it was out of the spasticity kind of thing, and she really had improved considerably. She was on national television for that particular thing. So umbilical cord stem cells, you know, we have this thing here, the politics of it is that frankly we voted in $3 billion of research on embryonic stem cells. You ask them about taking grant applications for umbilical cord stem cells and you're told, go ahead, but in general they're not going to give it to you. And why is that? It's because of money. And we're talking about embryonic stem cells, the kind of stuff that they're working on at the university or at Stanford and everything. Those are going to be turned into drugs. Those are going to be turned into drugs that they will sell to you, and they will make money. Not only the researchers, but the companies that are selling them. The state of California winds up making money, maybe even. And whereas umbilical cord stem cells, no drug companies can make money. You can't patent these cells. Nor can you patent fat-derived mesenchymal stem cells. Did you know that you can get stem cells for your dog right now, legal here in California? For any animal that you have, it's legal for you to get stem cells. Cost you maybe $1,500 to get stem cells for your dog or cat or horse. You can have the stem cells within 3 days. You go to your vet and say, I want this done. You go to vetstem.com, vet-stem.com, I think it is. In any case, it's amazing because it's so simple, and we could be doing it right now in our doctor's office. Dr. Miller and I, all of the doctors here, we could have our own little machinery going and be giving stem cells to each one of you, whoever needs it. But no, it's illegal. And so therefore, if we do it, we go to jail. So we have to change this kind of law so that doctors like myself who are interested, who know the techniques, can do these things. So, because there's just a tremendous amount of things that you can do with stem cells, and what we've been doing is learning. And so when people ask me about how effective are these things, I can't tell you how effective they are. We're doing research. I can tell you a lot of successes, but I can also tell you that there have been failures. And when we give patients who, I say, give a patient who's had a stroke 5 years ago, 10 years ago, we just give them stem cells. We don't see much results. Why? Because there are no signals in the damaged part of the brain. The brain is healed. The body heals itself after time. You have to have some kind of injury for the stem cells to go there and fix. And so this is just a copy of...
That by a little bit more slowly?
What's that?
About why they only work like when there's an injury that's just happened?
Yeah. We're just going to go quickly through stem cells, and stem cells. I don't know if everybody knows this. I'll just skip through all this. Does everybody know about the basic sciences? All right. So in that case, what we have at the beginning of life, when male and female get together, you form a baby. Well, it starts off with a zygote, where egg and sperm get together. That's a totipotent cell. That's a fertilized egg. Okay. And then from there, Now that totipotent means it can become a whole being, a whole human being. That one cell can become a whole human being. And when you let that cell divide a few times, 4, 5, 6 times, it will form a little round ball, and there's an inner blastosphere that you can take out some of those cells, and you can keep growing those in tissue culture and grow millions and millions and millions of these cells that are totipotent. So you could literally take, your sperm and your egg and put that together, and then you get these embryonic stem cells, and from there you could have 1 million test tube babies identical. Your daughter or your son, whichever this was, would turn out to be, you could have 1 million or 10 million or 100 million or 100 billion, because that's the way these things are. They continue to replicate. And so that's totipotent. Then after a little while they start to become specialized, and they start to become different kinds of tissue, and they're called multipotent cells. So like, for example, the cells in your bone marrow that are stem cells are hematopoietic stem cells, and what they do is they repair the bone marrow and they make blood vessel or blood cells, red blood cells and whatnot. Why does it do that? The blood vessels in the tissue, let's say we were talking about a stroke. In that tissue, that when you just had a stroke, let's say we have a stroke right now, bang. Okay, what happens? Well, within a few minutes, that tissue starts to be damaged and it starts to leak. The blood vessels start to open up and they start to weep, and fluid starts to pour out, and if it's really badly damaged, they'll break and they'll sort of auto-destruct. But there's going to be some tissue left, and the blood vessels are still going to be there to some degree. And if there's any blood flow getting through, those blood vessels will have changed their composition so that the stem cells can get into and through the blood vessels that have been damaged into the damaged tissue. So the stem cells have to get into the damaged tissues for them to work. So if you have a stroke today, if you give stem cells today, then if the stem cells circulate in your circulation for a few days, then as the stem cells get into that damaged tissue, they will then be able to infiltrate into the tissue and start to repair it. There have been studies that show that the optimum time after a stroke, for example, to give stem cells is 3 days, 72 hours. So if you give a stroke patient the stem cells at 72 hours, you're going to have the maximum amount of effectiveness if you're only going to give 1 dose of stem cells.
Do these go in IV or?
Stem cells can be given all kinds of ways, IV, subcutaneously, intraarterially, or you can directly inject. A lot of the scientists around are trying to do it by direct injection. I think they're nuts, because it's not physiological to do that.
I have a question. You mentioned earlier about those stem cells. Can nitric oxide, can you use nitric oxide to be able to harvest your stem cell to fix any abnormality?
Well, nitric oxide is not usually used to mobilize stem cells. Hyperbaric oxygen has been shown to mobilize stem cells, and a variety of other substances can be used. There are products, multi-level marketing products now on the market. One is called Stem Enhance, which is some extract of blue-green algae which supposedly mobilizes stem cells from your bone marrow. And once the stem cells are mobilized and circulating, then they can go to those areas and help fix it. We have, in my office, I've got a product called the Big Mover, which is fucoidin sulfate, which does that as well. And mine is about 10% cost of what the Stem Enhance is. Whether or not, whichever is better, I don't know. But in any case, you can mobilize your own stem cells from your bone marrow. And that's another thing to understand, is that the bone marrow is really a controlling spot for your stem cells and your longevity and your health. In the body, where the tissue has got the least amount of oxygen, stem cells live. So stem cells live in little niches where there's less oxygen than other places. Oxygen causes, in general, differentiation of stem cells. And that's a real dilemma because right now we're confused in the literature and in practice because we're being told that hyperbaric oxygen mobilizes stem cells, and on the other hand, we know that oxidation causes differentiation. And so if we mobilize the stem cells and then cause them to be differentiated, which means they become specialized into something like fat cells right away, then it doesn't matter if we mobilize them if they're not able to be used and become something that is useful. And so, in any case, the bone marrow has the oxygen levels are not very high in the bone marrow, and so the bone marrow is one of our main sources of stem cells that then circulate through the blood. So every day you have stem cells coming out of your bone marrow and circulating and going around in your blood vessels, and they then repair your arteries. And so if you have a high cholesterol meal today and smoke a cigarette, you're going to probably burn or damage some of the endothelium, the inner lining of your blood vessels, and the endothelial cells slough off, which you can look at a blood drop under the microscope, and I do that every day, and I can look at your endothelial cells, and I can actually count the number of endothelial cells you have and how much damage you're having to your blood vessels on a daily basis. Well, those need to be repaired. So if you're young and healthy, your bone marrow is young and healthy, and it puts out a lot of stem cells, and so it repairs constantly and well. But as we get older and older, the stem cells have the same problems that the rest of us do, and they start having genetic problems, and they start not being so good at replicating and dividing and multiplying and going out and fixing things. So part of aging is the failure of the stem cells being able to be mobilized and be circulated throughout the body to repair the blood vessels especially.
I'd like to come back to the gentleman's question about nitric oxide, because in the repair of arteries, there's a lot of research now out of Stanford showing that arginine is very helpful because it generates nitric oxide, and that encourages the regeneration of the endothelium, the lining of the artery. So, I mean, is there something to this nitric oxide idea, do you think, with respect to the repair of the arteries?
Well, I think it's controversial right now. Arginine lowers your cholesterol. That's one of the reasons why walnuts work, because walnuts have, and nuts and seeds have arginine. But if you also remember, the nitric oxide is involved with the immune system, and it stimulates macrophages to become more active. And so the nitric oxide is a free radical, and it works like a superoxide kind of thing, and so it actually is part of the killing process of a macrophage, and it helps burn things up. And so when you give a lot of arginine, you can actually increase inflammation. And so if you have rheumatoid arthritis or any autoimmune disease, if you take a lot of nuts and seeds, you'll get worse. And like if you have MS, one of my patients with multiple sclerosis had stem cells, and on the diet that we have, it said you can have nuts and seeds. And since I had taken her off of beef and other meats, she said, well, where am I going to get my protein? Nuts and seeds. So she started eating lots of nuts and seeds. And she calls me back in about a month and says, I don't know, I'm worse now than I ever was. It's awful. What? I thought I was supposed to get better. I said, well, what are you doing? And I got it out of her what she was doing. And sure enough, I said, well, stop the nuts and seeds, start taking a little bit of lysine maybe, and within 3 days, she was 100% better, you see. So arginine and nuts and seeds, they're a double-edged sword. And right now, the literature is still unclear as to whether or not it's valuable or beneficial. The last paper I think that I saw was it actually shows that people who take arginine and that kind of thing actually have more cardiovascular heart attacks than if they don't. And so it may very well be that yeah, the cholesterol is going down, yeah, everything looks better, but in fact, if you're getting more inflammation, you may actually then cause more problems. So I think the jury is still out as to whether or not it's going to be really beneficial on everything. It's hard to know, yeah.
Isn't one of the causing factors also low cholesterol? I mean, in fact, there was some literature showing that below 180 increases the factors for heart disease, liver cancer, things. So if you lower your cholesterol too low, then you increase the susceptibility to other things as opposed to the arginine.
Right.
Yeah.
Right. I think that's another whole controversy. We could have a 3-hour seminar on why you get low cholesterols and what it's doing metabolically to your system biochemically. And I think that still is, we're still trying to figure that one out too. Anyway, stem cells, definition, replicate itself. It can give rise to more specialized cells, or specialized cells, it's called differentiation. So the undifferentiated cell, which is a stem cell, that means it has no, the slate is clean, it can do anything and become anything. And once it becomes specialized, it becomes a specific kind of tissue. It's a nerve cell, it's a glia cell, it's a heart cell, it's a muscle cell. That's a differentiated cell. And then they home to areas of inflammation or areas of ischemia, lack of oxygen, lack of blood flow. So they tend to go there. And if you look at the tissue culture work, there's been studies that show that when you take stem cells and grow them in tissue culture in a situation where there's less oxygen than normal, the stem cells do much better and they grow better than they do if you give them normal amounts of oxygen. So one of the things that I treat people with before and after their treatment is lack of oxygen or high altitude. I have a machine that puts a person up at high altitude, and that helps, I believe, to cause the stem cells to proliferate once they're in the body. The kinds of stem cells, a lot of confusion about this. Embryonic stem cells, and there's the embryonic stem cells that are derived from fertilized eggs. You take a sperm and an egg in a tissue culture, and you put them together, and now you have an embryonic stem cell. Okay, but in addition, the baby, the fetus in the mother's womb, up until the age of 2 months, is called an embryo. So if you abort a fetus from the mother before 2 months of age and take the cells from that fetus, that's an embryo, and they call those embryonic stem cells. So we have a Dr. Rader who is located in Malibu or something, and he takes patients down to the Dominican Republic, and that's what he uses. He gets his aborted tissues from the Ukraine, and then they ship them down to the Dominican Republic, and then he gives them to people down there, or his doctors or whoever is down there. Those are aborted human tissues, and they have the same, if you look at them from a tissue culture point of view, from a flow cytometry point of view, and look at the markers, they are exactly identical to the umbilical cord stem cells, so that they're basically the same, and all we're doing is we're purifying. What we're doing in our work is we take the blood from the umbilical cord and we take the stem cells out, and then we put those in tissue culture and grow those in tissue culture, so we get a lot of them. They're all pure. We don't have any white blood cells or red blood cells or anything. So when you see a vial of stem cells, you should look, and it should be either clear or white, never red, because if it's red, that means that it's been contaminated by red blood cells, and red blood cells are mature, differentiated cells, and your body will react to those, and you will become sick from having taken those. And one of my friends was in Indonesia, I think it was. He's a weightlifter, bodybuilder, longevity expert, and he's into getting stem cells, and we gave him some stem cells, and so he knew what kind we gave, and then he went there, and they came out with a big vial of red stuff, and he got them, and thank goodness he didn't get sick from them, but those were not pure stem cells. Adult stem cells are basically, they classify umbilical cord stem cells as adult, but doesn't make any sense, but it's kind of like they do it anyway. And like I say, bone marrow is a source, and if you have cancer, in the past we've taken the bone marrow out of you and extract the stem cells, and then we give you chemotherapy or radiation, try to kill off the cancer, and then after we do that, then we give you the bone marrow back, and then the bone marrow is able to go into your bone marrow again and replenish and repair that, so now you can have red blood cells once again and white blood cells once again, because if you don't do that, you would be dead, because once you have all that chemotherapy and radiation, you've killed the stem cells in your body, so you need to take them out, save them, treat, and then give them back. And again, as I mentioned before, fat is something that is coming up, and like I say, dogs and animals can be done right now. You just take 2 tablespoons of fat under a local anesthetic. You got a little syringe, you put it into this culture media, send it to the lab, and they process it, send it back to the vet, and he's able to give it right into the joint or whatever. And like I say, that's eminently doable. And we don't need to spend $3 billion for that. All we need to do is change the law so we can do it. And then, of course, peripheral blood.
Is there some place outside of the U.S. you can go to have that done?
The vet stuff?
No, that same process for humans.
Oh, the fat type? Nobody that I know of. I'm trying to, but I've been trying. Mexico is difficult to work with, believe me. Just like Nevada is difficult to work with. Anyway, let's just keep on going. We've got a lot to cover here. A lot of people ask about how they're processed. The stem cells we're using come from basically a university laboratory here in the States, and so they're manufactured under FDA guidelines and whatnot. Yeah.
Actually, I had my heart disabled, and I'm pacemaker dependent. Is there any hope for me with live blood cell or the stem cells to repair my heart again so it will beat on its own instead of having to have a pacemaker?
Well, that's a good question. That would be research. And all you can do is try. What you do is you take the problem and you analyze it, try to figure out how best to take care of it, and then say, well, this is how I would do it. If we're given the state of the art that we have, and you got lots of money to throw at it, we can try. And really, we've had some good results. We haven't treated that, so I can't tell you. I have treated patients with, like I have one 85-year-old who came into me that her heart was beating so crazy she was barely alive. She was on oxygen all the time, and her heart was flip-flopping all over the place. And 1 vial of stem cells, and within 1 month, it reverted to a normal sinus rhythm, and she stayed in a normal sinus rhythm for 3 years. And now I saw her about 2 weeks ago, and she'd come out of normal sinus rhythm. She'd gone into paroxysmal atrial tachycardia and flutter and all that kind of stuff, and bigeminis and whatnot. And I said, "What have you done?" And she said, "Well, I didn't do anything." I said, "Well, you've got to do something." And I said, let me have a drop of your blood. I took the blood, looked at it under my dark field phase microscopy, and I looked at it and said, "My God, there's a snowstorm in your blood." And I said, "What have you been eating? What kind of fat are you eating?" "Oh, I've been eating avocados for the last month." I got into eating 1 or 2 avocados every day, so that's what I'm doing. And so she had loaded her blood up with so much fat that it was cutting down on the oxygenation. I said, "Okay, well, let me just see." And I hung up a little bag of heparin, and I gave her a quick run-in of heparin to clear out. Heparin activates lipoprotein lipase, and that clears out the chylomicrons, and that would open up her circulation and give her oxygenation. And before that IV was done, she'd converted back into normal sinus rhythm. And she's still in a normal sinus rhythm because I said, "Get off the avocado, for God's sake." So, there's a lot of tricks to staying healthy. Yeah.
I'm thinking about what you're talking about right here on that slide. In chirogenetics, where when the child is born, they save the the cord blood.
Yeah.
Is that whole industry legitimate? Is it honest? Is it worth $150 a year to keep paying somebody to keep that stuff frozen?
That's kind of like going to Vegas. You're betting.
The odds are that it's not.
Right.
I mean, if you need
Well, it is, but if you think about it, the umbilical cord stem cells are available even if you don't have that baby's umbilical cord blood saved. So if your child develops cancer and needs to have a bone marrow or a transplant with stem cells, you can get umbilical cord stem cells and give them, and they will work.
And there's no auto...
There's no rejection.
No rejection?
No rejection.
Interesting.
Yeah.
I mean, we bought into this program
Right.
thinking that it would reduce or eliminate the probability of auto rejection.
Well, it's still unproven whether or not if you take somebody else's baby's stem cells and give them to your baby or your child, whether or not that's going to be a permanent, long-term fix. So far, it has been. So far, we've got children that are now 20 years of age who had them transplanted when they were 3, and they're stable. And so it looks like everything is stable. It looks like they're working. Now, they may have started off with a blood type A positive, and now they've got a B negative. But it doesn't seem to cause them any harm. So yes, if you want to have exactly the same bone marrow and the same red blood cells and everything that you started with in life, then yeah, you have to save it. But right now, it's still possible to do these other things. So.
What do you mean by other people?
Well, I mean, you can go down to the hospital right now, and a baby is born. You can take the blood and take the stem cells out, and if somebody has just had chemotherapy and you've killed off all the bone marrow, I can take that and give it to an adult, and you will have your new bone marrow, but it's from this baby. And now your blood type used to be O positive, now it's A negative, because the baby's A negative, and you're always going to have A negative from now on. You're going to have red blood cells and white blood cells, but they're not your genetics. They're somebody else's. And you can tolerate it, and it doesn't cause any problems, which is...
Screw up your diet.
I'm sorry?
Screw up the diet for your type.
Yeah. You're in big trouble. Anyway, umbilical cord stem cells have been used since about 1988. There's been over 5,000 cases of these given. Each cord has about 300,000 stem cells, and most of those are all hematopoietic stem cells. The names that these are CD34, CD133, that's the most primitive hematopoietic stem cell, and that's the one in general we use. That's kind of our base stem cell that we use in treatment. That's in our book, what we use for all these kids with cerebral palsy and whatnot. And we've used, in our research, we've used the minimum dose, which is 1.5 million stem cells. So the fact that we got any results is truly amazing, because in general, stem cells are given in doses of 60 million, and we're giving 1.5 million. And still, with cerebral palsy, 80% or more of these children had significant improvements with just those few stem cells, with no preparation, no stem enhancer, fucoidins, or any kind of manipulation. Just give it to them in a shot, one simple little shot in the abdomen, and within a few weeks they're better and doing better. Now, there's also these mesenchymal stem cells. Mesenchymal stem cells are, like in the bone marrow, you have the niche that I was talking about before. You have, in the center of this niche would be the primitive hematopoietic stem cell, the CD34-133, and around it are the mesenchymals. The mesenchymals are the ones that are the connective tissue, and they kind of hold everything in place. So mesenchymals feed the other stem cells, and so the mesenchymal stem cells are cells that are very special in terms of making growth factors. So if you are getting older and you're getting weak and befuddled, not that any of you are, but if you were, if your grandfather is still alive and he's getting a little tottering, if you gave him a whole bunch of these mesenchymal stem cells, within 3 or 4 weeks, you'll see him standing up. Instead of having Parkinson's, he stands up straight, and his skin stops going from that weeping, fragile skin that you see in older people. That clears up, and the skin becomes strong and healthy. And in general, everything improves when you have mesenchymal stem cells because of all these growth factors. Mesenchymal stem cells also have the ability to, they produce certain interleukins, and these are immune suppressing and regulating cytokines. And so if you have autoimmune disease like lupus or Sjogren's or rheumatoid arthritis or whatever, these stem cells will help correct that quite well.
Cure lupus?
Yeah, if you give enough, in general. And of course, another thing is that all these things these things are repair processes. They do not correct the underlying disease. In other words, if you have a virus in your system, it does not get in there and kill the virus. So yeah, it can repair the damage. If your immune system is hyped up to the max and your body is destroying itself because of this hyped up immune system, it'll stop that and downregulate it and bring it back to normal. But if the virus is still in the body, it will then continue to grow, and over time, that immune system will start to get bad again. See? So it's one tool, not the cure-all for everything. So this is just quality control stuff. And
when you give somebody stem cells, there must be tremendous amounts of residual effects going on inside the person's body. So if you take somebody that had a stroke and you give them stem cells, it's like creating inside, internally, it must be like creating another human being.
No. It's really just an improvement in. It's like you were sick, you're laying in bed, and now somebody came along and gave you a little cup of coffee, and gee, you woke up a little bit, and you're starting to feel, hey, I'm actually feeling better. And then somebody else comes along and gives you an antiviral, and now the virus is gone, and now you're starting to feel better again. And it's just these steps. And so like yesterday, we had a very interesting case, a man who had a stroke something like 5 or 6 years ago, 7 years ago. Because one side is pretty well paralyzed. He's got a cane, and this one arm can't be moved at all, and his voice is garbled, can hardly understand him. And he went down, and we gave him, by way of femoral artery, we put a catheter in his femoral artery, ran it up into his brain, and then we used mannitol to open up the blood-brain barrier, and then infiltrated that area of the stroke with 10 million stem cells. By the time he left the clinic, he was speaking better. I talked to him on the phone. He says, Steenblock, I can't believe it. I haven't felt this good in years. I can't believe how many years I have since I felt like this. This is amazing. It's no wonder it costs so much. I swear to God, he said that. So, people get their improvements in different ways. With MS patients, a lot of times you see first they get the sensation starts to improve in their legs. If they were having pain, the pain starts to go away. If they didn't have any sensation, they start to have sensations. It's just a slow process, and you just start to slowly get better.
Well, isn't it surprising that it would work so fast? Because
well, because there's growth factors in this too. So these stem cells produce GDNF, glial-derived nerve factor, and these growth factors have a trophic effect and salvaging effect on damaged neurons. And so if there's any neurons that are there that are just not working well, they jump right in there and say, you can work, come on, you can work. And they work. And you get instant results that way.
A little hard to formulate the question because you skipped over some slides earlier that alluded to it, but I was thinking of Robert Gale's work with Chernobyl survivors doing bone marrow transplants. Is that like a earlier form of this before we had as much knowledge to know what specific?
Yeah, they were doing bone marrow. So I think they were doing bone marrow transplants. Yeah. And so they had to match. So that was what they were doing as far as I know. But I'm not an expert on that Chernobyl accident.
So they were, bone marrow was wiped out.
But they were taking transplants from other bone marrow people, frozen, somebody had donated bone marrow in some other country, and they were shipping those in and transplanting that bone marrow into those people.
Right.
But that's bone marrow. And so that's not pure stem cells. And that's why you have to match. See, if you take bone marrow and don't take the stem cells out, first of all, those adult stem cells are somewhat antigenic, not like the baby, the umbilical cord. The umbilical cord, you don't have the graft versus host reactions. With the adult, you do. So you have to match. You've got to find an identical Richard someplace, somewhere in Afghanistan or China. There's another one person who's got almost identical HLA ABO typing as you do. They get that person's and they bring it over into you.
I'm the universal donor.
Well, you wish. Yeah.
Those stem cells can be put everywhere. They are universal. Is that true for growth factor 2?
Yeah, you can. Yeah, if you had, if
It's also universal. It is not.
yeah, yeah. In fact, you can. There are certain growth factors that you can buy. In general, they're not too available commercially. They're pretty hard to come by. They're very, very, very powerful. And so, if you just like 1 microgram costs like, I don't know, $500 or something, a very tiny amount. And I think it's not even that, it's nanogram. It's a very tiny amount is very expensive. But there, you can take, there are some things that are on the market. Atrium, for example, is a company that has frozen porcine, brain and whatnot, embryonic tissues, and these have growth factors. And so when you take these embryonic organs that are frozen, they have some of these growth factors, and so you get some of that kind of effect from these frozen embryonic tissues that are. Somebody else has a duck embryo that they're selling now for that kind of thing. So you can get these growth factors in other ways than stem cells. Yeah.
I presume longer you go without treatment, long-term energy. Do you have any help at all? How do you use energy to help at all?
Well, all I could say is we could try. It's an experiment. We've had some success, and again, we'd have to go up with you. We'd have to go up into the brain, open it all up again, and shove a lot of stem cells up there. So, like this other guy yesterday, he immediately was feeling better and doing better. I could almost assure you that you'd see some degree of improvement, but I can't tell you how much. Ask me in 5 years after I've treated another 50 guys like you, then I can tell you. But this work is really early, and so I can't really tell you. I've had some results with Alzheimer's, but I haven't treated that many. Again, Alzheimer's is a multifactorial kind of disease. There's over 100 different kinds of conditions that simulate or look like Alzheimer's. 1/3 of Alzheimer's is due to vascular, and that's a case that stem cells will work for. And so that's 1/3 of those. So just automatically you can say that if you've got vascular problems like vasculitis, and you've got high fibrinogens and all these markers for blood vessel disease in a patient with Alzheimer's, that person should respond quite well because the stem cells fix the endothelium of the blood vessels, and that'll increase the oxygenation and circulation and stop the process. And the ones that I've treated have done well. Yeah, way back there. Oh, go ahead. Yeah, the blondes before the
I had a young friend who came down with acute onset leukemia, a teenage boy, and his life was saved with an umbilical cord transplant. But I thought that he did have rejection issues. He had a serious, sort of state, like not too long.
Yeah.
This would have been 6 or 7 years ago.
Yeah, I think what we've got is a disconnect between the universities and the hospitals and this work. This work is ahead of all these other places. And this was a work that was first developed by the Chinese. And the Chinese are doing the same kind of work in China. And the technique was that is the way of growing the stem cells and processing the stem cells so you get absolutely pure product. And that's what the hospitals have not had. For example, 4 years ago, I met with the president of the International Stem Cell Bank, and there's like 300 of these banks around, umbilical cord banks around, and asked them if they have a technique for purifying their stem cells like we do. And he said, no, they didn't. I said, well, would you like to buy the technique? And he wouldn't, he thought I was joking and I was making it up. And he wouldn't listen to me. So I said, fine, don't listen. But the fact is that if you get the stem cells really well prepared and made correctly, there's no problem. Okay? Yeah, sorry.
If we took like 3 conditions, let's say epilepsy, diabetes, and cerebral palsy with Parkinson's, can we say that in one of those, the stem cells, were the best, or
Yeah, yeah. I mean, I can give you preliminary results. Cerebral palsy, 80-85% of the patients will get better if they're under 12 or so. Parkinson patients, if they're prepared properly and get enough cells, I would say we're probably 70 to 80% improvement. Those people will improve. I can't say that they're going to have 70 or 80% improvement. I'm just saying that they're going to get some degree of improvement, and especially if they are treated like the detoxification and all the different things that holistic doctors do for Parkinson's patients to clean up their heavy metal issues and their hormone issues and their oxygen issues and all that kind of thing. And then diabetes, not good right now. Some people will say that, but as far as in our business, we haven't got anything that really helps the diabetic. Maybe type 2, but not type 1 for sure. There are some stem cells that are in trial someplace, but I haven't got access to them. I met somebody a year ago at the Federation meetings, and they had developed an insulin-producing stem cell, and so they were going through trying to get it through into clinical trials and all that. So it's coming along, I'm sure, and sooner or later we're going to have that. And the other condition was epilepsy. So far we've had good results with epilepsy. And especially, the ones that come to us are the ones that are intractable, incurable, have tried everything, done everything. And again, if it's white matter damage, then these stem cells work very well because they're able to fix the white matter. And so it's a real good tool to use on those real intractable cases. How it works for just the average general epileptic, I don't know. We haven't had enough to tell you. MS, again, the more active the disease, the better the results. So the patient is going down the tubes, and they've gone from normal, and they're just going down, down, down. That's the person that you want to treat, and you'll see them turn around and get better. The ones that's stable, 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 you have to do what I was telling this gentleman over here. You've got to generally open up the blood-brain barrier, open up everything, and flood the tissue with the stem cells. So.
Would you be so kind and take the questions at the end, because we're here to listen to your material, and the last 10 minutes we spent with questions.
Well, I'm trying to please everybody here, so maybe we want to have a vote. Anyway, here's just the thing about GDNF. I was talking about how that can help rescue the neurons, and then also the cells release the neurotrophin, nerve growth factor, and brain-derived growth factors, and all of those stimulate nerve growth. One of the reasons why I decided to go after cerebral palsy was because these CD34-133s tend to give rise to the white matter, and so I knew that before we started doing our research, and we knew that these CD34-133s, which are primitive hematopoietic cells, if they're not going to be bone marrow stem cells, if they're given a chance, they will go to the brain and turn into white matter cells, and that's what epilepsy is involved with, and that's what cerebral palsy has as a problem. So, and so that's why we use those, and that's why we got such good response. So there's different ways of thinking about how they could work. They support the injured neurons. They can fuse with the stem cells can fuse with the nerve cells, the damaged cells, and what happens when they fuse, you get, instead of having 46 chromosomes, you get 92 or whatever chromosomes together, so it's called polyploidy, and those cells have double the amount of DNA, and it's one cell with double the DNA in that one cell. Those cells seem to be stable and don't cause any problems, and we've looked at that for at least 20 years in humans, and there have been no problems with that kind of fusion. So again, we were talking about homing, and there's a number of different kinds of chemical signals that the blood vessels give off when they're injured, and they're wanting stem cells to come in and fix that tissue. And so part of what we're doing clinically is trying to replicate that same kind of signal so that we try to help the stem cells find where they're trying to go and where we want them to go. So we don't want them to go off and fix your foot when we're trying to fix your head. And so that's a problem with some cases when you're using the CD34-133s, which are very nonspecific. If you have an injury in your foot and an injury in your brain, and if you give them, they will go to your foot. If your foot is hurting more injured, then go to your brain. So you wind up fixing your foot, not your brain. There, the stem cells just float right by. They don't know what to do, so they don't do much of anything.
That's when you need to do the
Right. You need to be more aggressive, get in there, open up everything, and get them in that way.
How do you do that?
With a catheter. We have an interventional radiologist that runs a catheter up into the brain, through the femoral artery, through the aorta, up into the arch, into the carotid. And then we put mannitol in to open up the blood-brain barrier and shove the stem cells in. Yeah, it's been a little challenge to get the right team down there in Tijuana, I'll tell you. Yeah, this is done in Tijuana. In Dr. Ramirez's office, he has a cath lab, and it's just about 100 yards. The first building on your right-hand side as you go across the border, it's called the Lloyd Building. He's on the second floor. And this is just some talk about how some of the treatments that we do prior to and after this hypoxicator, which is that's a device that you breathe, and it changes the oxygen concentration of what you're breathing. So instead of sitting here at sea level, we could have you with this little machine sitting at Pikes Peak or Mount Everest in terms of the oxygen concentration you're breathing. And the idea then is that, for example, if you've had a stroke 5 years ago, that area is healed, but its blood vessels are not adequate. They've been damaged. And so if you take that person and put them up on the top of Mount Everest, the rest of their body has got good blood vessels, so the rest of the body and the rest of the brain may survive that, but that area that has been damaged prior is going to be more susceptible to the lack of oxygen. And with that, then you get a little bit more damage to that area that's already been damaged, and that then upregulates these signals so that the stem cells will then go to that. So we treat the patient for a couple, 3 days prior to their stem cells with this device, taking them to high altitude to change that, to change their system so that any areas of their body that have been previously injured or have damaged blood vessels are re-injured to a degree so that the stem cells know where to go. And here's a picture of that machine, a young lady who doesn't need it.
It sells well.
Sex sells always.
She's actually 93 years old.
That's right. She's had a lot of stem cells. Stem cells also produce VEGF, vascular endothelial growth factor, and that VEGF makes new blood vessels. So one of the things that stem cells do is helps make new blood vessels. It helps repair blood vessels. It makes new blood vessel linings, and it also makes new capillaries. It helps prevent the cells from dying, from apoptosis, and it has been shown that it stimulates the hematopoietic stem cells to promote the growth of new neurons and to replace injured neurons and brain tissue. We have used this. This is a new agent for treatment of osteoporosis. It's a parathyroid kind of injection, and there's been studies that show that when you give that prior to stem cell mobilization, you can increase the number of stem cells in your bone marrow by 10-fold. So if you want to increase a lot of stem cells, then you can use Forteo to increase your bone marrow stem cells. And then if you have some oral product like we were talking about with the Stem Enhance or my fucoidan sulfate, the big mover, that kind of thing, then that would help mobilize them. So that's another way. And you can also use granulocyte colony stimulating factor, which is what they use for mobilizing stem cells when we're doing cancer work, where we're trying to take your peripheral blood and draw stem cells out of your peripheral blood. To get the stem cells into your peripheral blood, the doctors use this material, this granulocyte colony stimulating factor. We give shots of that every day for 5 days, and then on the 5th day we put a catheter into your vein and draw the blood out, and we spin it down, and we take out the white blood cells, put the red cells back in, and then from the white cells, then we can extract the stem cells, and then keep those, and then give you the chemotherapy, and then later give you the stem cells back. So that's a typical way of giving stem cells now to cancer patients that have had chemotherapy and radiation. But you can also use this same stuff for healing heart attacks and strokes and a variety of other conditions right now without all that other stuff. So your doctor, who's a progressive doctor, if he studies this and the use of GCSF, he can find that this is quite useful for a variety of other things. And so you can actually mobilize your own stem cells for helping heal your tissues right now. Well, if you took them out of your peripheral blood, then you could culture them, yeah. And then we have a machine called the external counterpulsation. You probably have, everybody know about that? Everybody know about that? Well, so that's a nice machine because that stimulates VEGF production, vascular endothelial growth factor. And so if you're doing that before you're getting the body up to speed as far as this hormone is concerned, and that helps. If you keep that up after the stem cells too, then that's another thing, because the more VEGF you have, the more the stem cells grow. And the same thing is true for the granulocyte colony stimulating factor. That helps the stem cells stay alive and grow too. So all of these. Is
the counterpulsation done the week before
or
the week after? Or?
Both. If we're doing it IV or sub-Q, it'll be both before and after. If it's being femoral, then we don't do the treatment after because of the catheter placement and fresh wound. We can also use hyperthermia along with the hypoxia to enhance these inflammatory signals, and a variety of different techniques you can use to kind of get the target tissue reactivated. You can also use erythropoietin for stimulating the bone marrow stem cells and also the growth of the stem cells that you inject. I was talking about the sulfated fucoidins there. That stimulates the body to repair. A lot of people like that because it makes you actually feel good when you take a few of these every day. It actually does make you feel better for some reason, and I don't know if it's stem cells or what it is, but it seems to help.
Have you triggered seizures with your hyperthermia?
You know, I haven't treated, you can, but so far I haven't had any patients with seizure that need it, and probably I would not do it anyway if I could possibly avoid it. And then another thing sometimes we use is EDTA, chelation therapy, and not only for the heavy metals and everything, but calcium is a agent that binds the endothelium or the endothelial cells, the inner lining of your blood vessels together. So your blood vessels have these cells that line the inside, and they have gap junctions, and these gap junctions are held together by calcium. And so if you give EDTA prior to this treatment, you're actually dissolving some of that calcium, and that opens up the blood vessels more so that the stem cells have an easier time to get into the tissue. So no, that doesn't work. At least not in this situation, because I really need to have that calcium drop to a low level. We've already talked about the mannitol. This is just some, cerebral palsy stuff. This is just some 8 children were given transplants, and they had questionnaires and all that and whatnot, and no graft versus host reactions. At the end of 6 months, 62, 5 out of the 8 were rated as showing significant improvements. 2 children were rated as moderately improved, and 1 child was rated as slightly improved. So they pretty much all were to some degree. This is a child, this is an interesting case. I didn't know what was going on with this case. It was the father sent me the pictures, the MRI. I looked at it, I talked to the guy. I don't know who this guy is from Adam. I look at the pictures and say, oh God, this kid is a mess. He had like 80% of his brain was really damaged bad. It was terrible. And it was just a horrible brain. And he was totally blind. He was unable to walk. He was not talking. So he was a real mess. And his father said, well, what do you think? There's nothing, the doctors here say there's nothing that's ever going to help this kid. And what do you think? You got a chance? I said, I don't know, but when I look at it, I think so, because these stem cells really work on the white matter, and I think if anybody should get a good response, he should. And he says, okay. So he went and had the stem cells, and then about every 2 weeks or every week he'd call me and say, this kid is not any better. When is he going to get better? What's your problem? I think you're a ripoff. I think, I'm going to turn you in. And I said, thanks. I said, listen, I told you it was a lot of damage. It's going to take some time. Relax. And every week he'd call and complain about that he wasn't getting any better. And then after 3 months or so, he was sitting there on the floor in the living room, and his brother threw a ball, and the ball rolls across the room, and the kids tracks the ball. And Dad just about, wet his drawers, and he went berserk. And from then on, the kid could see, and now he's got glasses, and he's seeing, and he had some more stem cells, and he began to talk and walk, and Dad has turned from this thinking that I was a total quack into becoming one of my great supporters. Thank goodness, because he was an attorney for the Department of Consumer Affairs for the state of Florida. You see, I have a habit of sticking my foot right in it and saying, oh, gee. Where's my neck?
David?
Yeah.
Why didn't you ask the father, what do you do?
I know.
I ask every one of my patients, what do you do?
I'm not a good historian, I guess.
That's called the CYA.
Yeah. Thank goodness it worked out, though. I'm still alive and practicing, so I've gone through a lot of those, and I'm still alive practicing. This is just to show you the kind of growth that these stem cells can have. Here's a kid who was underweight and undersized, and in 2 months, she gained 4 inches in height and 12 pounds. That's a child who's like, 30 pounds, and to add 12 pounds and 4 inches in 2 months is truly a miraculous situation, I think. And then that just tells that her speaking she started to speak. This is just a myoclonic epilepsy case that disappeared within three days or so. Ruth is from up here. I'm surprised Ruth didn't come. She doesn't live too far away from here. She has diabetes type 1, and this is a different thing. We're not treating the diabetes, but we're treating the diabetic retinopathy. And she was legally blind, and within 8 months after her stem cells, she's out. She got her license back and started to drive. And this is just some cases on stroke, showing improvement. This is a current patient of mine who was in December was dying basically, and was wheelchair bound and getting progressively weaker, and was starting to aspirate a lot, and you could tell that he just had a few weeks to months to go, and we gave him 12 million stem cells, and within a month his energy returned. He had swelling one part of his neck was totally swollen up because he'd had some surgery, and it had been swollen since the time of the surgery 3 or 4 years ago, and all that swelling went away. His leg edema disappeared. His heart, in other words, improved. So it helps a person with ischemic cardiomyopathy, where your heart is not doing well because of lack of oxygen. If it's lack of oxygen, this stuff will get in and fix it. So if you have that kind of a condition in your heart, then it's going to help fix that, okay? Because it makes new blood vessels and all that. This is a post-polio case, and again, within several weeks after this treatment, he started regaining function. He's now up out of his wheelchair, and his progress has been amazing, according to him and his trainers. Other things we've been doing are gene therapy, and so our lab is able to make and insert genes into the stem cells, and so we're able to actually target a particular disease. We did the first child in the world with metachromatic leukodystrophy, and she received this particular gene with stem cells, and it's taken her some weeks, but she gained muscle strength, and she was able to start breathing on her own, and she's done quite, for a girl who was given up, she's supposed to have died at 3 years of age. She's still alive and going, and has improved considerably from that. Then we have a stem cell with interleukin-2 and gamma interferon, and we're using that for metastatic cancer in cases that have tried everything, done everything, and are not, don't have any other options. And so, because, like I say, it is experimental, I don't want to tell anybody to come down and have this stuff as a replacement for normal therapy. This is not a replacement for normal therapy. It's experimental research, and we're trying to see what happens with people who have diseases that are incurable and have no hope.
How much does the treatment cost typically?
Which kind?
Just the basic stem cell.
The basic, well, the cancer is like $5,000 for treatment. For 2 million stem cells is $8,000, and then if you buy more, the cost goes down. So if you buy like 4 vials, then it goes to 20. And then if you do that surgical procedure, the surgical procedure, the cath, and all that is $5,000. So the minimum, if you're going to do like a brain case, I recommend would be $25,000 you'd spend on that, because you want to make sure you get enough stem cells in there. You don't want to go through all that surgery and that anesthetic and all that and not have a real good chance of seeing good results. So
you either buy a new car or a new brain, either one.
That's right. New car, new brain. That's right.
What's the length of the procedure?
What's the time? It's probably an hour. It varies depending upon how tough you are. If you're a tough bird, in other words, you got real bad blood vessels and all that can stretch out, and it can take some time. But if you're a pretty healthy fellow otherwise, and you got the blood vessel here is okay and whatnot, it goes quick.
1 day or 5
Yeah,
days?
it's a one-day thing. You're down. You have to be there. If we're talking about the surgical procedure, that kind of transplant, or if you're going to give the IV, that's just down there. You're there for about 2 hours, and then you turn around and go back home. That's all. With the catheter, you have to be down there for at least 6 hours. So sometimes you stay overnight, sometimes you can come home. Just depends upon your condition. And this is a case with metastatic prostate cancer that he had all kinds of problems, and when he came in to me, and he got the stem cells, and within like 3 or 4 days of him getting the stem cells, most all of his symptoms had disappeared from. He was catheterizing himself and a whole variety of things, and was impotent. And then now he's got 3 lady friends, and he's out chasing girls every night. This is just an example of another kind of stem cell that we have for MS, which is the FIN gene. The FIN gene is one that makes white matter, and so the idea there was that that would help enhance the repair of the myelin. And this is a case with those same kind of stem cells with MS, and just showing that that he had improved considerably.
That's a really big dose, right?
I'm sorry?
It's a really big dose.
3 million. Yeah, 300. Yeah, it's not right. That's a misprint. He had 3 million of each one. So you have 3 million CD133, 3 million 34, 145. This one, the 34, 40, well, whatever. This one is the neural progenitors. These stem cells are the ones that the Koreans reported in November of 2005 where, I think it was 2005, where they had a 36-year-old gal who was paralyzed for something, I don't know, 19 years or something, and they operated on her, and within 3 weeks she was up and walking. And that is that kind of cell. I sweet-talked the Koreans into letting me know what that was, and so we were able to get that secret because they weren't wanting to tell us. And then these were the Fin genes, and then these were the 3 million of the primitive neural stem cells, which is even more primitive than the CD34 45 plus. And then the next thing we've done is SOD genes, and so that's for ALS. That's also, we've just started doing that. And then there's some of the people that are coming down for anti-aging. Again, anti-aging is the same kind of thing I was talking about before. You need to have some kind of thing to open up the circulation so that the cells can get in through the body. There's no reason really to take these things unless you do something to get them into your body. Now, if you have problems, like when I had my first stem cells, I had a lot of arthritis, and within a month, my arthritis was about 80% better. And so they go to where they're needed, basically. If they're not needed, then you won't get them. So if you're pretty healthy and have no problems and you still want an anti-aging effect, then you need to do something like the hypoxia and the chelation and kind of open up everything, and then have your wife beat on you with a rolling pin or something. So you want to kind of beat up everything so that everything is opened up.
Arthritis is usually thought to be autoimmune, so what did you do to cure the underlying problem?
No, that's osteoarthritis. I don't have autoimmune, I have osteoarthritis. It's a collagen disorder, genetic weakness of my collagen. My mother had arthritis, in other words, it's passed from your mother to your son. And then, of course, like I was saying, some of the things that we do see with people who take the improvement of skin color, your hair color, I don't know about that, hair color. I guess my hair has gotten a little better. Muscle tone, I think you have increased feeling of well-being. There's some increase in libido, arthritis. Some different things you can do for your own self is things that we know, and that's yeast is poisonous to your body, and we've been talking about sugar and how sugar is bad, and people, you know, it's amazing how many people don't realize that sugar is not good for you after all this time, you know. I've been listening to Frederick Stare too much. Frederick Stare was, so you guys remember that? Frederick Stare was the head of the Department of Nutrition at Harvard, and he got $1 million grant every year from Betty Crocker or something, and he promoted sugar. He says, he's a PhD, head of the Department of Nutrition. Sugar is good for you, because he got $1 million from the food industry every year. And it just was like the public just bought into it because this guy's from Harvard. You know, you got to start thinking a little bit. So, yeah.
Gene Meyer was from Harvard.
Yeah, there you go. Yeah.
Stare is basically a whore for the food industry.
Oh, that's true. Absolutely. Anyway.
Have you had luck with both types of macular degeneration?
Both types. Yeah, I know. I was just trying to recall the cases, all. Well, I tell you for a fact, in general, the wet is much better handle. I would handle that first with hyperbaric before I'd recommend you go running off for stem cells. But I think both of them would be benefited. Yeah, I don't see why not. I have, macular is very interesting. A little known fact, and at least as far as I'm concerned, is that in many cases of macular, there's infection in the patient's sinuses. In my last 15 cases or so, we've had about at least 12 of them have had chronic sinus infections. And the ophthalmologist has no clue that there's actually something other than an eye up there. It's the macula, that's all there is. There's nothing else there. You've got a macular problem. It has nothing to do with the rest of your body, which is not true whatsoever. The macula is, and the fovea, that central part of the macula, is the most metabolically active tissue of any tissue in your body. It requires more oxygen than any other tissue. And it starts to get atherosclerotic, just like the rest of you. And so when you start getting older, and the blood vessels start getting more tortuous, and the blood flow is not so good, your heart is not beating so well because you're getting old and you're not exercising, etc. There's a lot of reasons why your oxygenation starts to decrease. Well, what happens, especially if at night you have nocturnal hypoxemia, lack of oxygen at night, intermittent. Intermittent lack of oxygen is a very major cause of a lot of problems, and I think especially macular degeneration. And the reason for that is because what happens is when that oxygen deficiency occurs, those cells that are becoming oxygen deficient are stimulated to release VEGF, vascular endothelial growth factor, and that then is a signal to make new blood vessels to bring oxygen to the area, because that's what's happening, lack of oxygen. So when the tissue is suffering from a lack of oxygen, it has a survival system set up. It's called HIF, or hypoxia-inducible factors. There's about 760 different genes that are turned on by hypoxia. And some of those genes produce these growth factors that make new blood vessels to grow into the tissue to repair it. Well, that sounds very good, and that would be what you'd want if your eye is not getting enough oxygen. You want new blood vessels. And that's what happens. You start getting new blood vessels, but then you get a growth factor signal for a few minutes, and then it stops because you get up and move around, and the blood flow starts going better, and you don't have any more signal. So you get intermittent administration, or intermittent stimulation of the system. So you get intermittent growth factors, and that causes these capillaries to grow, and then they die back. They grow, they die back. They grow, they die back. And what does that mean? That the blood vessels become very weak. They're not built structurally correct. And then they become, because of that weakness, they start to leak. And now you start having fluid and all that kind of stuff. But if you gave, like, the hyperbaric oxygen every day, every day, every day, you get a growth signal every day, it's consistent, and you make new blood vessels that are then stable and strong, and your eyes are then good for the next 50 years. And I have patients that, like 3 years ago, were totally legally blind. I put them through a course of hyperbaric, and now, without their glasses, they can thread a needle. And they're stable. 3 years later, they're still able to thread a needle. And they were told there was no hope. They were legally blinded when they started. So that point is that if you do it every day, you get these blood vessels back and they're healthy. The guys that are ophthalmologists, they have all these new drugs that are VEGF inhibitors. They want to inject it and stop that new blood vessels from forming. Why? Because those are bad blood vessels and they're the leaky blood vessels. And yeah, it helps because it stops those leaky blood vessels. But it doesn't correct anything and doesn't repair it. Hyperbaric oxygen repairs it and makes new blood vessels that are healthy and stable. So use hyperbaric oxygen for the wet. Okay, if that fails, then you can always move on to other things. And one of the other things, like for dry, is the external counterpulsation. That helps with that, and you can use chelation sometimes for that too. But if all of those fail, then you go do stem cells. And unfortunately, the best way to do it is with that femoral artery catheter approach. And you have to treat 3 days before with a laser. And I have to go in and we have to actually re-injure that part of the eye that's been damaged with a laser, re-burn that a little bit, just a little bit, and then by the time you're ready to give the stem cells, that's ready to accept the stem cells, and you give them, and then you get results like Mr. Bulger, who had that procedure, who was totally blind and now can see. Yeah?
The stem cells are so generalized that they can do anything. What are stem cell lines, and how do the stem cells know how to turn into other tissue?
Number one, if I knew it would take us probably 3 years for me to tell you all of that information. But I don't know all that information. I don't know how all those. I'm going whatever it's the 5th International Stem Cell Research Meeting is going on next week in Toronto for 4 days or so, and for 4 days I'm going to be bombarded with people who are trying to answer that, and I'll sit there in a daze going, huh? Huh? What's all that about? And it's a whole new language. You know, there's so many new things that are being discovered and whatnot. It's very complicated.
Why are certain stem cell lines okayed by the administration?
Well, that
That's a political issue in that sense.
yeah.
Do you have any experience with the pros and cons of enzymes in terms of like proteases or lipases or even the anti-fibrin enzymes like nattokinase in terms of their effect on stem cells or the therapy?
Well, we haven't really explored that much. What we've done is we've basically taken our page from the cell transplant, the live cell kind of thing. And with live cells, they've always taught never to use proteolytic enzymes after these cells because that caused inactivity and you wouldn't get results. So because of that experience, we've always told people not to do the proteolytic enzymes after the stem cells just because of that history. I haven't really wanted to experiment on humans, you know, because it's your money and I'm trying to get you better, and so I don't need to say take the enzymes. Now if you're stupid enough to not listen to me and then take the stem cells and do the enzymes and then you call me and tell me that you took them and you did great, then I'm going to change my opinion. But until somebody does that, I'm not going to give them to you. I'm not going to tell you to take them because of the fact that the enzymes, I think, have a tendency to cause problems. And why, I don't know. Maybe that I'm wrong. We don't know.
And is the same thing with heparin? Do you think
heparin is okay. Heparin is not a problem. We know that already. Okay? So that's something. The book you can buy on Amazon.com or
What's the name of it?
Umbilical cord stem cell therapy. And on the handout, your handout, there's a phone number or this number. And if you call that number, then that's a donation, and you can write it off in your taxes.
Is this a good place to stop?
Huh?
Is this a good place to stop?
Is this a good place to stop?
Good stuff. Great stuff. Well, I'll tell you what. Let's David will be here to take questions, you know, after the meeting. But let's stop the formal meeting now. It's been a fascinating talk. Tremendous.
See you next time.
It's a lot better than Stanford.
I have a very
Just try some B5.
Okay, good. That's
Also
good.
known as
Okay, good.
Pantothenic acid.
Pantothenic acid.
Pantothenic
Okay.
acid.
Somebody else, another comment. Is it Richard?
Yeah,
Richard.
they package it with propolis and Siberian ginseng, and you know, when you make that combination, honey, propolis, Siberian ginseng, royal jelly, you're likely to get something that's good for you.
Mhm, okay.
That's usually how they mix them all.
Okay.
I have an article here by Jonathan Wright, newsletter, his health letter of May. He's talking about last November researchers reported an association between low blood levels of aldosterone and hearing loss in older individuals. Simply put, the more aldosterone in the bloodstream, the better the hearing. Anybody ever heard anything about that?
Well, I can tell you that Lowell and I both saw the same article, and we both lived it. I mean, because we're both having hearing problems. And, you know, it's looked good to me. One thing going for it is Jonathan Wright. I mean, the man is a sage. I mean, he's a reliable source.
Oh,
Not that he's always
you need again?
But this here is good, David. You have no problem with this here. You're on my good sides. But it looked good to me. The only thing is, I think it's hard to get alder test. It's kind of related. It's in the steroid pathway with all the steroid hormones, right, Steve? And it's right next to testosterone, pretty right in there. So it's surprising that it would work, but apparently it does. But it's hard to get, I think. I don't know. Or maybe you get it from a compounding pharmacy, you probably need a doctor's prescription. But the other thing that's happening, you know, is they're learning how to regrow those little hairs in the ear. They're learning how to use growth factors and make those little hairs in the ear regrow. So I'm hopeful that, you know, by the time I'm 80, I'll have good hearing again.
I'm getting a lot of hair in my ear. Does that mean I'll start hearing better?
Yeah, that's a funny one. Isn't that funny how that happens?
Could you just tell me what issue that
It
was?
was May 2006. Yeah, Jonathan Wright. His newsletter. If you put in Jonathan Wright, W-R-I-G-H-T, Jonathan, and you'll probably get to an archive of his newsletters, I think. Yeah. So it's a good one. You know, all kinds of great stuff there. Okay, who's got something else here? I'm going to call on somebody here. Just say, oh, what do you run into that's interesting lately? Say, what have you run into that's interesting lately? In the paper. I say, what have you run into that's interesting? I call it on you as well.
I think you'd say.
I'm part of the Smart Life group over in Rossmore. That's a retarded community of older folks. And I have trouble hearing. So when he asks me something, I don't understand it. And I've heard about this aldosterone article as well. So I certainly want to look into it. I'm 81, and I think I'll live only about 19 more years. So hopefully Dr. Wright does more research on it. So is there anything else?
That's it. Is there anything else you'd like?
Oh yeah,
Change the subject? Go ahead.
Phil's been helping us a tremendous amount. He can't do anything without helping. He's coming over to give a second talk to our group in a week or so. He does that sort of to practice his skills. We don't have the audience that you have here with all the technical skills and the interest and younger, like my friend here is a little bit older, but I don't want to tell anybody. So we're getting a group, and it's been tremendous help. I appreciate all the support we're getting from you, who are supporting Phil and the rest of us. And we hope to have these kind of Smart Life chapters all over the place. I can't think of anything else except say my wife's got breast cancer, and she's been treated. Was found too late to make it simple, so she had to go through the whole treatment. And I've been over here at Stanford University. We're getting MRIs because we hear that the Stanford University MRIs are better than anybody else's. Not the machinery, but the interpreters, the skill level of the people. Because she's now got a cyst that is suspicious. And the doctors in the East Bay just, the first thing they want to do is aspirate. And then I read Dr. Ralph Moss' newsletter about 3 or 4 weeks ago. They said back in 1940, when the cancer cancer treatment manual was first made, the first thing they said was, if you identify cancer, don't cut into it and don't poke into it. Because if you do, you could pull a needle out, and then this stuff just comes out and spreads to your body all over before you even had the results on the report. So the doctors in the East Bay said, aspirate. And we said, no, we won't. Because we know Phil, he doesn't have 15 degrees like you guys do, but he says don't do that. So, wish us luck.
Well, you know what I say, I don't know about that, but I do know that Ralph Moss is a great source for any kind of cancer. Ralph Moss reports on cancer. It's one of the most wonderful institutions in the country as far as health goes, and Lowell discovered it independently, actually, without my help, but we both admire his work.
Moss? M-O-S?
Ralph, M-O-S-S, Ralph Moss. The man is phenomenal.
What's the institution?
Excuse me?
What institution?
Well, he's an institution in himself. He's got about 200 and some different reports on every different kind of cancer there is. Plus, he's got a lot of general, you know, theoretical pieces on cancer, and he's extremely good, extremely detailed. Documents what he says. I mean, the guy is, in my opinion, doing it exactly right. I mean, I don't know, does anybody have a different opinion? I mean, a lot of people have seen his work.
Where is he located?
I don't know where he's located, but you can get his reports. Like Lowell got the one on breast cancer. It cost like $200 or something like that. Michelle.
just add, because I've actually I've spoken to him and read his books and dealt with his organization. It's cancerdecisions.com, and he has a thing called the Moss Report, and it's about $275. And if you're diagnosed with cancer, then he will he'll develop a protocol for that specific type of cancer. So it's cancerdecisions.com.
Great. Okay, that was Michelle from Monterey. But oh, here we go. Thanks, David. Yeah, cancerdecisions.com. Yeah, and I think I've never heard anybody speak badly about him, and I really think he's an independent, honest, hardworking guy. And really, $275 is cheap. I mean, if you're dealing with a problem that's going to cost thousands of dollars. The only thing is, of course, that Medicare doesn't cover it. But, you know, I hope you're all past the idea that you can only do what your insurance pays for. That is only lunatics think that, believe me, if you don't mind me saying so. Because they're so far behind that you'll be dead before they have to pay for anything. Yeah, yes, sir.
Phil, there's some kind of a new sales onslaught in the Bay Area for a product called Xanga, X-A-N-G-A.
Zango, yeah, I've heard.
Yeah. Does anybody know anything about that?
Jim, do you know something about it?
Somebody just called me today about it. Said, do you know about the Zango? Because they do all the health shows, you know, or attend them anyways.
It's mangosteen.
It's mangosteen, yeah. And
Mangosteen apparently was used by the islanders because it's a very powerful antioxidant. So it would probably be the island version of blueberries, is my guess. What other properties it has, I don't know. Steve, you might know. I'm not sure. I was going to mention also, if people go to the Townsend Letter for Doctors and Patients, they may have archived Ralph Moss's articles in there. So I think that's the one he writes, where he has a regular column in there. So you can get a clue on how he speaks and the information he gives off, if I'm not mistaken.
What was that, Jim?
That's the Townsend Letter for Doctors. It's one of the few magazines I subscribe to. That Life Extension.
Yeah, but I can tell you though that that's a good suggestion, but I think it's probably unnecessary because on Ralph Moss's website, he's got a long, extensive archive of his earlier articles.
Okay.
So, you know, and it's fascinating reading.
Do you want to know any more about the Zango?
Oh,
Zango.
Yeah, sure.
I'm a distributor, but I'm not doing business. Well, I was for a long time, but I'm not now. But I am taking it, drinking the juice. But it has, it's helped people with Parkinson's a lot. It's helped people. I haven't been to the yearly meetings, but at the yearly meetings, people have gotten up and given testimonies of being healed of cancer on it. But they have to drink like a whole bottle a day, and it comes in like a quart-sized bottle. And it just does a lot for the immune system. It's got the blueberry stuff. The main thing is it's got the xanthones. Last I heard, they had 42 and then 50 something. I'm not sure how many it is now. I haven't been going to the meetings. But it's got many of these xanthones, which are much more powerful than the vitamin C or whatever it is that's in, what do they call those? An antioxidant. And the thing about Zango is there are a lot of companies out there that are selling mangosteen products because once Zango was the first company to come out with it. Am I talking too long? Do you want this information?
Just a little bit.
A little bit more. Zango was the first company to come out with Zango. The man that whose father is the head, founded Nature's Sunshine. His son, who is a researcher on nutrition, was in Indonesia and came upon it by being served mangosteen as a dessert, and he loved the taste of it and started finding out that the monks were using it for healing people, and that people were using it for healing malaria, and I've forgotten what the other diseases were, but diseases that are endemic or whatever the word is to that area. But they started the Zango company because, and there are many out there copying it, and really the only company that is really got, there are many on internet that'll have graphs out there that say that Mangosteen has this many xanthones, and their company has this many, Zango. And Zango is the one that has the most. I'm just,
okay.
So that's...
Okay, good. Well, the question is always, what's the science there for that? And, Jim, I think, made a good observation. It's sort of like in the blueberry family, and as you probably all know, blueberries, the science behind blueberries is tremendous, and it seems a little bit implausible at first that a fruit could have all these, powerful medicinal powers, but blueberries it does, and so does pomegranate, and they've done a lot of testing on it, a lot of science. And I did do some research on blueberries myself, and it's amazing. I mean, you can improve balance and memory, and they've done this with mice swimming around in water looking for platforms that they can't see and stuff. If you give them blueberries, their memory improves, and they get to the platform faster, so they take a break, and stop swimming. So what I'm saying is there is a lot of science on this, and it's therefore something to be taken seriously. Now, I don't know what mangosteen is all about, or how it compares to the other things, but I do know that there's a lot to be said for those pigments, those colors that we find in fruits. They're just tremendously valuable. There's a book out by a Tufts researcher, Tufts University, called Color Code, I think. And it'd be a good place to look. So, something that should be taken seriously, and it's cheap and inexpensive. At Trader Joe's, you can get a combination blueberry, pomegranate, and cranberry in one bottle. And I buy it. It's very good, and they give you the interpretive information. It saves you spending $250 to go to the doctor's. Although, of course, I'm not saying you shouldn't do that too, because you should if you can afford it. But if you're going to do it monthly or something, it might get kind of expensive to do it that way. And you can get a lot of information by doing saliva tests and monitoring your estrogen. So, yeah.
I'd like to add one other caution to the hormone testing, is that some hormones have very pronounced circadian rhythms to them. And therefore it matters a lot whether you get tested at 10 a.m. or noon. And when you go to your doctor and get tested, oftentimes it's always done at their convenience, whereas if you do it at home, you can always make sure that you always do it on a Tuesday and at 10 a.m. You can collect the sample reliably so you can mitigate those hormone fluctuations.
Yeah, good point.
Bill Harris.
Yes, sir, Todd. I'll be right back there. Okay, here's Dr. Todd Kaufman again.
Thank you. Well, in reference to what you're saying, a lot of the take-home tests will give you a cycle to do it on. My concern is that when people do self-diagnosis tests, that you have information and you could follow what they're saying, but I think it's important to always do a follow-up with some health professional that specializes in something. Otherwise, you could be chasing symptoms where if you have, like if you do a hormonal test and it's elevated cholesterol levels, you could look at, there can be many things going on.
Sure.
And it takes sometimes a good diagnostician to separate what the multiple factors are. You deal with Lyme's disease, which could mimic multiple sclerosis and a multitude of different conditions. So it's good to do those tests at home and keep the cost down. And then that's what I have my patients do, is bring the tests in for interpretation.
Good. Okay, I think that's absolutely true. I've been studying this now for 12 years, and so I know just a little bit. But for those of you who are newer, who don't have the kind of time to put into it that some of it has, you definitely need to work with somebody like Todd Kaufman or Phil Miller or Bob Kepker, or one of our good people who is kind of hip to hormone replacement. Richard.
Quick comment, one quick question. Meditation is supposed to boost DHEA naturally, and both these guys know a lot more about hormone replacement than I, so maybe one could comment on 7-keto, because that's supposed to be the only safe DHEA supplement to take, and you're supposedly not supposed to need monitoring when you take that.
Very good question. Want to talk to that, Steve? Anybody know about 7-keto? Is it true? Is it true?
It's not DHEA. I mean, that's the first one.
Okay.
Yeah, it's a derivative of DHEA.
But do you get the same benefit, do you think?
I don't know if you get the same, but there's a lot of those kinds of issues that go on with hormones. If you have a hormone that's nearby, for example, it's been known for probably 50 years, 60 years, that in cell culture experiments, if you're trying to grow human neurons in a cell culture experiment, if you don't put in pregnenolone, progesterone, or DHEA, one of those three, they will not grow. They'll die. And if you put those in, if you're putting in DHEA, you have to put in 10 times more DHEA than either progesterone or pregnenolone. So both pregnenolone and progesterone have profound neuroprotective effects for the neurons, which is why the brain may hyper-respond to pregnenolone supplementation and progesterone supplementation regarding aging-related and dementia-related kinds of processes, forgetfulness, senior moments, that kind of stuff.
Now one thing that some of you may not know about is, what all of us are referring to, Todd and Steve and myself, is we have in our mind, in our heads, a picture of the steroidal hormone pathway coming down from cholesterol to pregnenolone. As Todd said, pregnenolone is the mother of all hormones, and then it branches out and it comes down DHEA and progesterone and testosterone and estrogen and the various estrogens and so forth. And that's what we mean when we say that they're close to each other, for example. And this is biochemistry, and it's very helpful. And really, as I say, science is way ahead of medicine, partly because medicine is not up on its biochemistry, strangely enough. But, and for example, most doctors don't even know that there is such a thing as natural progesterone. They don't know that there's they're not familiar with the concept of bioidentical hormones. When we talk about hormones here, we're not talking about the kind that got Barry Bonds in trouble and so forth. We're talking about bioidentical hormones. What's that mean? It means that exactly the same molecule that you supplement. I do testosterone supplementation with transdermal cream every morning, and I just take a little bit, like about as much as at the top of a pencil and eraser worth, and it's bioidentical. It's the same exact molecule that I had in abundance when I was 30, but don't have in abundance when I'm 70. So, and then I also do, I also take a very expensive pill called Arimidex, which is an aromatase inhibitor. Aromatase being the enzyme that increases as you get older, if you're men, and starts to turn testosterone into estrogen. So, because I don't want to be kind of like defeating the purpose by taking testosterone only to see it turn into something that's bad for me. So, so anyway, just mention that. I tell you that just so you'll know that we're serious about what we talk about here, and give you an idea, how it works. Somebody over here, yes, sir. David.
I just wanted to make a comment about DHEA and stroke. And since I've done a lot of work on stroke, I did a study with different dosages of DHEA and found that as I increased the dose up to 200 milligrams a day, I had a linear increase in the stroke rehabilitation efforts. So the patients who got more DHEA did better in terms of recovery.
Yeah. And Steve's report is that DHEA, pregnenolone, and progesterone are all conducive to the growth and thriving of nerve cells, neurons. So you might want to try progesterone, for example, too. See how that works. But okay, well, how are we doing? Okay, we gotta stop here pretty soon. Okay, good. Here we go. Yes, sir.
I'd like to point out that there's a very interesting book called Safe Uses of Cortisol by William McKay Jeffries. There's a third edition out. Reducing cortisol is not always the best thing to do. For example, you need certain physiologic levels of cortisol. The Aeron urine and saliva test can be arranged so that you actually test saliva 4 times through the day so that you get this whole cycle. With many people who have arthritis, rheumatoid arthritis, they need a little bit of cortisol, not prednisone, which is very strong, but very small amounts of cortisol, and they need that 4 times a day. So when I started out with this business, I couldn't close my hand farther than that, and now I have no problem, and this is Cortef 5 milligrams 4 times a day after being tested.
Did you say who you are?
Oh, I'm Ed Darwin.
Good. Well, that's terrific. That's good stuff, Ed. Yeah, everybody get that? I mean, that cortisol is not, too much of it will kill you. But, you definitely need the quote, the right amount. And so if you don't have it, there'll be problems. So, in fact, people with adrenal fatigue sometimes, have not enough cortisol. Okay, now a couple quick things here, and then we'll take a break. I wanted to call your attention to an article which I saw in Science News, the last issue, I guess it was. No, May 27th. Remember we had Denise Cooley-Johnson come in and talk about chloramines in the water. And that was kind of alarming because now instead of using chlorine, for whatever reasons she told us, I can't remember, but they're not using chlorine, they're using chloramines. And there's some problems with chloramines. And to tell you the truth, I can't remember what exactly the problems were, but I was pretty scared when I heard about it. But in this article, there's a problem here, some new research. I wanted to call your attention to it. It says, this is in the as I say, the May 27th issue of Science News. It says, a disinfectant used by U.S. water utilities dissolves lead in laboratory experiments. The finding bolsters the notion that the disinfectant, called monochloramine, may be responsible for increased lead in some drinking water supplies. Utilities have traditionally disinfected drinking water with chlorine. However, the chemical can react with organic compounds in water. And so some utilities have switched to monochloramine, a compound of chlorine, nitrogen, and hydrogen. But anyway, it goes on to say that as a result, they've got tremendous 48,000 parts per billion in Washington, D.C., where they're using chloramine, where I think the safe level is 15 parts. So instead of 15 parts, they've got 48,000 parts. Now what this means is if you live in an older house and you have lead pipes, and the water company is sending the chloramine through your lead pipes, it's leaching that lead right out, and they've tested it on a film. It's quick. Not only is it not good for your pipes, it's worse than that, whereas it's not good for you, because lead is tremendously damaging, especially to cognitive function and so forth. So it's really a tremendous problem, and I don't know exactly what the solution is. I mean, if anybody has time to help Denise fight this issue, I'll put you in touch with her. Yes, ma'am.
I have a comment to make about that. I'm not exactly sure when this happened, but I believe it was sometime in 2004. San Mateo County's water is now treated with chloramine. Mm-hmm. And my understanding is it does liver damage. I'm not sure where the research was, but I remember reading that.
I believe it's an article down in this county too.
Yeah,
it's all over the Bay Area now.
Yeah, all over the Bay Area. So the only thing I can think, short of, getting legislation on this, which what we really need to, because, we don't want to just save our own hides. But I really think that it might be worthwhile to buy bottled water or get one of Jim's filters. Jim, your filters take lead out, don't they? Or do they?
Well, I always recommend a good lead reduction filter. They take out like 90% plus of lead. And anyone that owns their own home or was first up in their apartment building to get up, always run the water till it gets cold if the building was built before 1980. Because there wasn't a regulation on the lead content of the solder that was connecting the copper pipes. It may be copper, but always flush your pipes in the morning. It's very, very important.
How long does it take?
Well, you just wait till the water gets cold, and that means it's coming from the street.
Yeah, but I mean, couldn't that take like 5 minutes or something?
Not necessarily.
I mean, I'm not so concerned about, it just seems so wasteful and inconvenient.
Yeah. There are chloramine filters. They're
effective. Being healthy, I guess, Steve says, is inconvenient.
Where does the water go?
Water where?
Where does the water, you say it's wasteful, where does the water go?
Goes in the bay, I guess.
And where?
It's recycled.
The ocean?
And then where?
Makes dumb fish.
So you think it's not wasted?
No, it's recycled.
Well, okay. I mean, as long as we're not having a drought. I mean, there have been times when... But anyway, that's not the issue. The issue is, that the stuff is dangerous, and so, I'd like you all to know about it. And I really think if somebody has some time to help her, I mean, this is an issue that has to be dealt with. I mean, I know we're all busy, but, if somebody can help, let me know, and I will put you in touch with her, because this is a big one. Yeah.
I found out one thing, I can talk loud enough, that in someone contacted the San Diego County Water District. They officially banned the use of chloramines in San Diego. and maybe because there's some millionaires with millions of dollars worth of fish that died. Just as they did in the entire East Bay, every koi fish in Golden Gate Park, ancient koi, all gone. They're all gone now. They live very short time in chloramines because it won't break down, and as Denise said, it takes up to 10 minutes to try to boil it off. If you were to have a shower filter to want all the chloramines out, then most of them just take the free chlorine out, you would need a lot more contact time. Hence, like these bath balls they have, you can leave it in for 7 minutes. It will get rid of all the chloramines. It neutralizes the whole ball of wax there. Some people are allergic and have skin reactions that look like ringworm, so if you know people that have that reaction, you might contact chloramine.org because they have a lot of people contributing, as well as some scientific research that may be available on the website as well. Oh, right there. Alrighty. The chloramine crowd right here.
The chloramine where?
Right there, you're pointing to. Oh, you get skin reactions?
No, I'm talking to him. I'm
Oh,
sorry.
I'm sorry.
okay.
Sorry.
Okay. Okay, one other quick report. I got a nice handout there on some new research that Bill Grant's involved in, and it's